Many thanks. I can see that we are still continuing with our introduction as we also continue admitting more other participants. Ensure that you've indicated your name, organization, um, and also where you're joining us from. Welcome to today's session. Many thanks, colleagues. And as I had mentioned previously, my name is Dennis Kioko. I'll be moderating the session today. I support the Global Cluster Coordination section in UNICEF on localization, and happy to connect and us discussing walking the talk on nutrition in walking the talk on localization in nutrition clusters. As I had mentioned, again, just to also request again and reiterate, for those of us who are yet to introduce ourselves, please do introduce yourself in the chat. You can mention your name, organization, and also where you are listening, where you are joining us from. I'll request that the presenter please proceed to the next slide, and we'll start our presentation with just some few housekeeping rules. So I'll invite Isaac, if you can take us through interpretation. Thank you.
So good afternoon, everyone, and welcome to today's session. In terms of language translation, we'll be using the caption option, which is provided at the bottom of your screen on the menu bar. So on the menu bar, if you click the caption, you can select the respective language that you'd like to see the caption narrative enter. So for the example that you have on screen, we have the option for French. Once you click it, the caption narrative will be popping up in French language. Likewise, we have all other languages. The only missing language is Swahili, but the rest will be provided and it's available there. So over to you, Dennis.
Many thanks, Isaac, for the tech. So we'll proceed and just get to hear opening remarks from, just proceed to the next slide, please. We'll get to hear opening remarks from Dr. Hiba together with Dr. Rasha. And just to mention that Dr. Hiba is a nutrition program manager from a national organization called Building Foundation for Development in Yemen. Just also to share that Dr. Hiba is currently also the nutrition cluster co-coordinator at the sub-national level, and she's also the gender focal point for the national nutrition cluster. Interesting also that Dr. Hiba is a member of the Anti-Racism and Localization Working Group that is being hosted by the GNC Alliance team. So I'll invite Dr. Hiba to give us opening remarks. Then I'll also invite Dr. Rasha later. Many thanks. Over to you, Dr. Hiba. Thanks.
Hello, hello, Dennis and everyone else. And welcome to the official announcement of the Global Nutrition Cluster Localization Roadmap at the Humanitarian Network Partnership Week. It is with immense pleasure and significance that we gather here today to shed light on the importance of the GNC Localization Roadmap. This document is very important for me, for my colleagues from the task force, and also for my colleagues working locally in their respective countries, and most importantly for the GNC. Up until recently, localization has been the buzzword for the humanitarian community. It's something that extensively has been talked about, but with less commitment and small steps and efforts towards it. But today, I'm really thrilled to say that this roadmap represents not just the crown of the effort, but also a pivotal moment in the GNC's commitment to the localization within the humanitarian response. The journey has been very long. It's composed of many reflections, dialogues, collaboration that result in well-structured documents that serve its purpose. As we convene here today, it's very crucial to recognize the vital role of the local LNAs in humanitarian efforts. Our involvement is not just desirable, but indispensable for the sustainable solutions. By engaging LNAs, we ensure that the assistance reaches those in need swiftly, effectively, and with the same level of quality and capacity. And that's why localization is very essential. Being one of the team, I could proudly say that this journey has ensured local voices were heard at the global level, and it was a very eye-opening experience. This experience has been a labor of dedication and passion. It's also a testament that the GNC collective believe that the people in need deserve to be reached and assisted promptly with equal access to a quality service. It's a pledge to bridge the gap and assure that voices of the local communities are heard and responded with the urgency they deserve. As a local NGO worker in a country that witnessed one of the worst humanitarian crises, with one of the third of its population, they're facing verge of hunger, I would say that this roadmap would signify a transition from merely hearing about localization to actively advocate and working towards it. Today, I could say I'm humble to speak not just for BFD, but also for all local-led actors everywhere, and say this roadmap was very crucial to see the light. This will allow us to have a tailored humanitarian response to better meet the specific needs and preferences of our affected population, and recognizing our innate understanding and cultural and social context in different complexities of our communities. In my opinion, I see this is very vital in saving lives and meeting and mitigating the impacts of a disaster. By empowering local NGOs and local actors and more additional involvement of the local efforts into humanitarian response, this will open a door for a greater likelihood of implementing sustainable solutions that can facilitate a longer-term recovery and develop initiatives that address the root causes and not just respond to emergencies, and build more resilience. I believe this document will support LNAs in their strengthening organizational capacity, in their enhancing leadership skills and technical expertise in various different activities that we will discuss. This will also contribute to the overall development of local civil society. I also believe that this approach will ensure fostering a sense of ownership and local empowerment, a dignity and a self-reliance among the affected population, leading to a more better outcomes. I'm truly honored to be part of this today, as this is marking a day not just for unveiling this document, but also the reaffirmation of the GNC's commitment to the humanitarian principle and empowerment of the local actors. Let's embark on this journey together today with determination, compassion, towards more inclusive and effective humanitarian response. Thank you so much, and over to my colleagues.
Thank you.
Rasha from the GNC.
Thank you. Thank you very much, Dr. Hiba. What a great way to start our session. also hearing from a national actor who is also a co-coordinator. The next presenter is Dr. Rasha. Dr. Rasha is the Deputy Global Nutrition Cluster Coordinator for the field support, and she leads the rapid response team. She has over 21 years of experience working with both the UN agencies, line ministries, and also the Red Cross and the Red Crescent movement. So happy to hear from your end also, Dr. Rasha, in your opening remarks. Thank you.
Thank you, Dennis. And good morning, good afternoon, everyone. It is a great pleasure for me to be with you all today to jointly launch this GNC localization roadmap. As you know, the purpose of this roadmap 2024-2025 is really to provide an overview of the GNC current effort contributing to the localization agenda while articulating activities required to support a more enabling environment for a locally led humanitarian response at country level. GNC is strongly advocating to strengthen the localization and anti-racism approach. Hence, the development of the localization roadmap was very crucial to provide a systematic guidance on supporting the localization agenda. Let's always remember that we need to be as local as possible and as international as necessary. We need to ensure that the response should be locally driven and locally led. Localization is the most effective way to achieve sustainability and to create a change and the long-term impact that we are all looking for. Let me take this opportunity also to share a few examples of what GNC works on localization and how it looks like. National authorities are co-lead the different type of established coordination mechanism overall, especially for the officially activated clusters or sectors in almost all cases, to lead the response and to lead before, during, and after emergency with the support of cluster or sector coordination team. We advocate that subnational coordination to be led by subnational authorities or NGO partner, preferably nationals, and provide the needed support where needed. International support for emergency response maximize its contribution to resilience building by contributing to capacitating the national actors. Communities and CSOs are agents of change in preventing, identifying, and always addressing nutrition and emergency related issues. Local national actors guides, shape, and implement the response at all admin level, which strengthen community engagement and community-based platforms for service delivery. Opportunities are maximized for supporting local solutions, such as localization or localizing the productions, sourcing of supplies, and other forms. National actors can always reach out to GNC. We have the GNC website, you have the support button, reach out to us, highlight what support needed, and we'll be always there for you. Thank you so much for being here with us today. It means a lot to us. I hope you will find this webinar useful, and please allow me to thank the whole Anti-Racism and Localization Working Group members, with special thanks to Denise, Alexa, and Martha for the great and endless support. Thank you so much. Over to you, Dennis.
Many thanks, Dr. Rasha, for those kind words. We'll proceed on, and I would like us to do a poll. So this is also where we also need the participation of everyone. So there's a poll that we are running. Please just respond to that poll, and the poll is really asking what kind of organization do you represent? We want just to get a feel of, local. Are you from a local or national actor, or are you from an international actor? So I can see the responses are going on. We'll give ourselves 2 minutes to respond to. And then for those of us who have joined, and I see a lot of Dennis Kioko name, please rename yourself to indicate your actual name. 1 minute remaining. Thank you. 1 minute remaining. As we take on the poll, for those of us who have just joined right now, please also introduce yourself in the chat box, your name, organization, and where you're joining us from. Okay, I'm remaining with 30 seconds to go. Thank you very much, colleagues. What I see from my end is that we have 33% of the individuals who have joined us are from a local or national actor. And then we also have 67% who have joined. They are from an international actor. So hoping that as we also admit other more participants, we'll see the numbers of also local and national actors going up. Colleagues, just to echo what Dr. Hiba and Dr. Rasha, they have mentioned, we know that local actors in most of the cases are usually the first in and the last out. We know that they stay with the communities that they serve during, during and even after disaster. We know that it is key for us to ensure that we are strengthening their participation, their representation, and their co-coordination within the respective humanitarian clusters. And to be precise here for today, we are talking about nutrition cluster. Without further much ado, I'd like to invite Alexa to take us through the real meat in our lounge today. This is the GNC localization roadmap. And just to mention that Alexa Humphrey is the GNC interim localization help desk and co-chairs the GNC anti-racism and localization workstream. She's currently based in Lisbon, Portugal, with nearly a decade experience across various humanitarian, development, and fragile contexts. And she's committed to shifting power while centering the work of local and national actors. Colleagues, let's invite Alexa to share with us the reflections on the GNC localization roadmap. I'll just request, whilst Alexa will be presenting this roadmap, please take note on some of the key things that really excites you, because that will be one of the next, during our panel discussion, that we'd like all of us to participate in. Thank you.
Great. Thank you so much, Dennis, for introducing our session. Thank you, Dr. Hiba and Dr. Rasha, for starting off with such inspiring and strong opening remarks. I am very pleased to be joining you today to provide an overview of the GNC localization roadmap. During this brief presentation, we're going to get a sense of the need and the objectives of this roadmap. We're going to see how it was developed, what it contains. And then just after, we're going to look at some example activities in the roadmap with the support also of our fantastic panel. So this roadmap came into being because of the acknowledgement that although the GNC strategy document 2022-2025, although it mentions localization, there was a lack of really clear actionable steps forward. And so with this in mind, it was agreed that we wanted to develop a GNC localization roadmap that would summarize the ongoing GNC efforts that contribute to localization, that would also articulate the GNC's theory of change, and that would chart a way forward for creating an enabling environment for localization. And we also want it to be quite complementary to and act as an annex to the GNC strategy. Next slide, please. Now, for the purpose of this roadmap, we wanted to be clear about what we're talking about. So we applied the framing of localization that was developed by the GNC Anti-Racism and Localization Working Group. We articulate this as localization being based on the recognition of an imbalance of power between international actors and the communities they serve. We also talk about it being a restorative process, and this involves the recognition, respect, appreciation, and investment in local and national humanitarian capacities, as well as leadership, as well as local and national resources. And the aim, as we see it, is to really replace this imbalance with a locally driven, locally led, and locally owned response to better and more sustainably meet the needs of affected populations. Next slide, please. Thanks. For the purpose of this roadmap, we applied the ISC definition of a local and national actor. And this includes both non-state actors, such as local and national NGOs, local and national civil society organizations, that can include private sector involved in relief. Also Red Cross, Red Crescent, if this is established by the government, it's at national level. And it also includes national and subnational state authorities and governments. And we find it's important to be very clear when we're articulating what an LNA, what a local or national actor is, because sometimes there's the assumption that it's limited just to national NGOs, but there actually are a number of different actors that we would consider local or national. Next slide, please. In the roadmap, we also articulate the why behind localization. We talk about localization as being especially essential for the nutrition sector because LNAs are often the first to respond. They generally have greater access to and trust of the affected population. They possess a contextual expertise that can help deliver results. This is especially important, and contextual expertise can include knowledge of a local language or local languages, knowledge of local customs, ways of being, communication channels, existing relationships and partnerships with nutrition actors and others. We also recognize in the document that LNAs are diverse and they develop to meet the unique needs of the populations they serve. They can be Indigenous-led organizations, they can be LGBTIQ+ organizations, they can be minority-led, they can be organizations of persons with disabilities, they can be refugee-led or women-led or youth-led, and even others beyond, depending on the context. We also recognize that local and national actors quite often remain in the communities they serve before, during, and after the emergencies, as was articulated very nicely earlier during the opening remarks and reinforced by Dennis as well. And LNAs are in a very strong position to link the humanitarian development and peace nexus. Next slide, please. The roadmap also articulates the GNC's theory of change for localization. And if we start in the top left with this little greenhouse, it starts by saying that if the GNC recognizes and strengthens the technical and institutional capacities of local and national actors, including, as we said, authorities and governments, and if the GNC enables their participation, representation, and leadership in coordination and decision-making spaces, including advocating for their increased funding and equal partnership with international actors. Our believed outcome is that LNA visibility will increase and NIE response and anticipatory actions will be locally led, ensuring that support is quality, timely, and contextualized to better serve and improve the nutrition status of vulnerable populations. Next slide, please. From the onset, it was agreed that if we were going to produce a localization roadmap for the GNC, it could not be done without the leadership and direction and insight of local and national actors. So when we convened the GNC Localization Task Force, we were intentional about ensuring we had representation of those with lived experience in humanitarian contexts and specifically representatives of LNAs. We have 14 members for this task force who were very influential in bringing the document together, 6 of those representing local and national actors. And in the spirit of visibility, I'm just going to pause and take a moment to appreciate the local and national actors who were part of this. So we had African Relief Development Initiative, RD in Somalia. We have Building Foundations for Development, BFD in Yemen, who Dr. Hiba is representing. We have the Jesuit Center for Theological Reflection, JCTR in Zambia. Delight Affection Foundation, DAF in Nigeria. Juba Valley Development Center, JVDC, also in Somalia. and Kazura Mimba, Catchment Conservation and Education, KACCE in Tanzania. We're very thankful to these organizations for their time, their dedicated time and insight, and their support in making this a reality. We also thank, of course, all of the other task force members who are very influential. And also this would not have come together without the strategic guidance and leadership from the GNC, including the GNC SAG and leadership team. So just thanks to everyone who was a part of it. Next slide, please. In terms of actually developing the document, we applied a consultative collaborative process for developing the roadmap. This began with a series of working sessions with the task force, guided by the task force chairs. The first session was really about idea generation. So we started with essentially a blank slate, and we asked task force members to throw out ideas and suggestions, really without limitations. We just wanted to see all the ideas that would come out of the first session. The second working session, we focused on with the task force on taking these bigger ideas and translating them into something more actionable. And then for the third working session, we really refined them and turned them into potential draft activities for the GNC. Next, we took advantage of a meeting in Geneva in October of last year to get feedback from our SAG during a group work. And then we also, during this period, had a prioritization exercise. And then the roadmap was again reviewed by leadership for more insight and influence, and then went back to the task force to sort of bring everything together and finalize it. The document has since been designed and finalized, and we're very excited to launch it with you today. Next slide, please. Just to give a quick overview of the sort of structure of the roadmap itself, it's composed of 3 parts. The first part is the background and includes an introduction, an overview of the global localization agenda, and it articulates the need for this roadmap, some of those concepts we just saw a few moments ago. Part 2 is a summary of the current GNC contributions to localization. We don't use the language localizing the GNC because the GNC is a global entity, but we talk a lot about how the GNC contributes to and can support an enabling environment for localization. And then part 3, we summarize the development of the roadmap. We talk about the theory of change, which we saw earlier. And that's the important piece, or probably the most important piece, is where we articulate the roadmap activities, which are really the heart of the document. Next slide, please. One other important thing to highlight, the roadmap itself presents an 8-point plan. This is aligned with the ISC recommended actions to increase participation, representation, and leadership of LNAs. And this also aligns with the GNC strategy 2022-2025. So each of those points aligns with the ISC. And then aligns with one of the GNC strategic objectives, Objective 1, people, Objective 2, operational and technical support, or Objective 3, enabling environment. Next slide, please. Okay, great. So I had mentioned earlier about the activities that we developed and that really make up the heart of the document. The roadmap includes 42 activities, again, in alignment with ISC recommendations. Each of the activities has specified leads, or a lead could be a team within the GNC or an individual or individuals. There's a specific time frame for actioning, and there's a note on funding status as well. We don't have time today, unfortunately, to explore all 42 activities, so I'm just going to present one example, and then the panel is going to take us through some more. This example I have here is of 42 activities. Activity 26 reads, within the updated GNC communication strategy, ensuring a dedicated section for localization and centering the work of LNAs to increase their visibility. So this is really saying, how do we shift our focus and then make sure that we're not focusing uniquely on international actors, as sometimes is the case, but we're being very intentional about telling the stories of LNAs and highlighting their good work, and naming them and showing their logos. The leads on this, we have the GNC Communications and Reporting Consultant, and then the GNC Localization Help Desk, so I'm supporting on this as well. This is a current ongoing activity. We're hoping to complete it during this quarter, and at this time, this one is fully funded. We have other activities which are not, but this one is. So that concludes my presentation. I'll say thank you. Handing back over to you, Dennis. Very excited to hear from the panel. Thanks.
Thank you very much, Thanks very much, Alexa. Before Alexa started her presentation, I had requested that we take note on some of the few the process and also the discussions that went through in the development of that GNC localization roadmap. So please be ready to type in. I just want to ask one question, and we will all respond to this question in a chat box. And the question is, are we all ready? The question is, type one word that best describe the GNC localization roadmap based on Alexa's presentation. Type in one word that best describe localization from your context on the GNC localization roadmap based on Alexa's presentation. I can see people are still thinking, so we'll give ourselves, there's inclusive, locally led, action, participatory, practical, empowering local community, locally led, actionable, interesting on actionable, people-centered, locally owned, ambitious. Okay, so for those of us who still would like to continue sharing, you can still share. At this juncture, I would like to switch gears a bit, and we will move to our panelists. So Isaac, if you can project our panelists, please. And we'll begin by Dr. Rasha. I'd already introduced Dr. Rasha. And then after Dr. Rasha, the question that I will ask, then Dr. Rasha, once you've responded, I'll introduce the next panelist. So just to ask, based on Alexa's presentation, and also because based on your understanding of this GNC localization roadmap, what is the one activity in the roadmap that you think most support your ability to walk the talk on localization? I know it's a bit technical question, but over to you, Dr. Rasha.
Thank you so much, Dennis. For this question, and as my capacity as the deputy for Global Nutrition Cluster Coordinator for the field support. So the activity that I feel really speaks to what I'm doing and what I can support the most is under the participation and representation recommended action from IASC. So and if you ask me what is participation representation means for the humanitarian coordination, so it is a driver for change to improve the collaboration and partnerships with local national actors, which is in line with the GNC Strategic Objective 3, the enabling environment. The activity in particular under this recommended action is the GNC to update the GNC Strategic Advisory Group SOBs to promote equal and principled partnerships between the GNC, local national actors, and international partners. Actually, these will be implemented under the GNC leadership team. We are planning to have it as a time frame in Q3 2024, and it is supported, funded. And this activity is to foster a more enabling environment for localization through promoting the equal and principled partnership between the local national actors and also the other international actors at global level. Keeping in mind that, power imbalance and unconscious bias may influence the setup of the coordination structures. So members and those facilitating the coordination group should take steps to create an enabling environment for local and national actors to participate and take part in the decision-making processes under the coordination structure, and to facilitate more systematic and active engagement of the communities and local national actors. So updating the GNC Strategic Advisory Group, SAG, SOBs, will support in working on how to better reflect the localization approach. This includes update the composition of the GNC SAG to include local national actors representation, which will be a very good shift in line with the localization roadmap. All the established coordination mechanisms, clusters, sectors are co-led by government national authorities. This is the case in most of the cases. We have only like exception of 3 cases, which are very exceptional circumstances. And however, even with these exceptional circumstances where the national authorities are not able to be, to address their rule and accountability for this rule, we also plan to develop additional guidance on local and national actors' leadership under these exceptional circumstances. Also, continue to have local national actors strong representation at country level SAG. Currently, 100% of country level SAG for all established clusters and sectors have a national actors representation. Looking to increase local national actors participation in the technical working groups under the coordination mechanisms. And these include local authorities, national NGOs, and different type of local entities, as well as Alexa explained in her session. Advocating of having local and national NGOs also represented in the HCT and other high-level fora. And based on the approach of the first, the local support is explored, and then regional, and then global. GNC also adopted a decentralized approach to provide support, which is the decentralized RRT and regional level RRT support. We have established this approach to be able to provide dedicated regional level support for countries under each region to make the support close to you and dedicated for each region, believing in the different context, and that each support should also be designed based on the different context and different needs. GNC has also established regional consultation meetings, a communication channel where regional specific priorities and issues discussed, collective action identified, which always feed into the global GNC discussion on the way forward and the priorities. The localization roadmap will serve as an annex for the GNC 2022-2025 strategy in support for a strategic shift in adding this kind of localization lens to the second term of the current GNC strategy. The roadmap will also support on and reinforce the entire next, the new GNC strategy. We are not only actively raising resources for GNC, but also increasing the resource mobilization skill sets for our local national actors and partners. This includes also what we are going to do in terms of a webinar series that a GNC resource mobilization team will be conducting shortly for the coordination team and partners, especially the national actors, and will be conducted soon. So this, in a nutshell, some of the key lines under this activity that I select for this panel discussion. Thank you. Over to you, Dennis.
Thank you very much. I gathered some key points. One, creating an enabling environment, the issues around SAG, ensuring that also local and national actors are part of SAG, and that localization is one of the big shifts moving forward on the GNC. Many thanks, Dr. Rasha. For those of us who are still following up, please take note. We will have a session where we'll have a question and answers, and also we'll provide opportunity for reflections on the strategy. The next panelist is Dr. Mayada. Dr. Mayada is the program officer, Sudan Nutrition sector, and she also supports the WASH sector coordination both nutrition and wash sector coordination at both national and subnational levels, as well as UNICEF Sudan surge capacity during emergencies. So I'll invite Dr. Mayada still respond to the same question on what is the, in terms of the activities that have been listed, what is the one that you think most support our ability to walk the talk on localization, to walk the talk on localization? Many thanks.
Thank you very much. Thank you, and good morning, good afternoon, colleagues. On behalf of the Sudan Nutrition Cluster, we'd like to express our sincere appreciation to be invited to participate in this exciting event. It is an important process to strengthen the delivery of the nutrition services to children and mothers. So the activity that we thought that best reflects the Sudan cluster activities was to support the local actors in developing project sheets and to obtain humanitarian funding. Just to give you a brief background of how this has really been contextualized in Sudan, since the eruption of the conflict in Sudan last year, multiple nutrition partners have reduced their operational presence and capacity in hotspot areas. To give you an idea, 8 of the 18 states are considered to be inaccessible due to insecurity. And so to continue providing life-saving nutrition services to vulnerable population, sector partners, including INGOs and UN agencies, strengthened their collaboration with local and national actors who had the advantage of on-ground presence and community network to deliver these services. So we would like to highlight some of these examples of how the nutrition cluster in Sudan engaged with NGOs to support their HRP, to support their humanitarian funding during this past years. So firstly, the sector organizes from time to time orientation and briefing on proposal development. Now, while this invitation is sent out to all sector partners, we have noticed over the years that the increased participation from the national NGOs as well as from aspiring partners. This has signified their interest to take part in this process. Secondly, in consultation with colleagues at the subnational coordination forums, national NGOs with a comparative advantage to support nutrition services have been advocated for fund allocation. This is in discussion with stakeholders, and over the years, the number of nutrition sector national NGOs who have received direct funds from humanitarian funds at the national level has increased. Now, while this number is not exactly very high, it is promising to see that from time to time, from over the years, more and more national NGOs have been selected. Thirdly, the sector encourages INGOs to support mentorship of national NGOs in their areas of operation. So the sector has been monitoring this process as well as supporting INGOs, encouraging INGOs to take this leadership role at the subnational level. This has improved the participation of the national NGOs, not only at the sector level, at the subnational level, but also at the national level. And as well as this has supported them in familiarizing the discussion on how the allocation of funds takes place at the subnational level, and also how the sector has supported the participation of local actors in technical working groups. Now, in Sudan, we have benefited from these inputs in the development of the advocacy message in the participation of the sector strategic advisory group. And so these national NGOs have been able to come in and provide their insights into not only how should these advocacy messages, for example, highlight, but areas taking into their own experiences. The advocacy messages have actually been much more contextualized and actually have supported much more funding opportunities. So fourthly, the sector dedicates one-to-one introductory sessions with new and aspiring partners, starting with invitations to cluster partners at the subnational level and taking them stepwise manner into the national briefing sessions. Now, this includes also an introduction on the roles and responsibility, helping to demystify the cluster approach. The sector also guides them on how to build their profile at the subnational level, and we have seen how this over time has actually attracted INGOs, and stakeholders to actually engage with these local actors directly to support in implementation and delivery of these services. And partners have been able to build on that as time goes on. So in closing, this brings us to how we can support opportunities for local actors to obtain humanitarian funding. Local actors have the interest, they have the appetite to support nutrition humanitarian response. However, the challenges they face are linked with opportunities to access the funds that are appropriate for their response. Whether it's through mentorship program or through a cluster to designate a specified block for national actors, there is room for local actors to grow. The transparency of allocation of funds is pivotal in this process. I thank you, and over to you for your discussion. Thank you.
Many thanks, Dr. Mayada. Very strong points, especially on supporting local actors to access funding through supporting them on project sheets, and also supporting them to supporting in demystifying the cluster approach so that they are also able to participate in the clusters. I'll hand it over to Dr. Hiba to still respond on the same question. And I had already also posted the question in the chat box. Thank you. Over to you, Dr. Hiba.
Thank you, Dennis. It's a very informative discussion. To answer this question, I would say that there are a lot of activities that captured my attention, but I would say that the activity that really resonates deeply with me is one of the capacity strengthening section. And I think it's number 14, activity 14, which reads as GNC to clarify and confirm its offer to support LNAs, including the ability to host various coordination platform webinars led by LNAs, provide technical support, language translation, etc. In my opinion, I think this activity not only reflects a broader goal for empowering local NGOs, but also highlight transformative impact of a personalized, tailored support that aim to dissolve language barrier and build the capacity. I think it's a concept of capacity strengthening in a tailored manner, as I mentioned. And I feel like I needed to speak about this because it's an experience that I had, and I have been, supported generously by the GNC team over many years now for various things. And I believe that in the localization, they would do the same for also other locally led NGOs when they approach them. I would speak a little bit about my experience, and I would also encourage all of the local NGOs to seek the same, to have support from the GNC. I would say that my organization had sought assistance from the GNC, and I was really, really genuinely surprised by the professionalism of the team, their level of response, their commitment. And they didn't just offer the generic advice or resources, like this is the resources and you can go and find it by your own. It was more tailored assistance that suited our specific needs and challenges. I believe that they invested long time and energy in understanding the unique context, the need. They conducted different analysis, and they provided a targeted response that really made a difference. I also want to say that I myself am currently benefiting from a mentorship program, which is tailored to exactly my goals. And I would say that this will extend as well to supporting localization and the capacity strengthening in localization. I also would say that the essence of the activity 14 symbolize more than just a training program. It will show the commitment and the sustainable change that drive huge impact in the communities. I also would say that if we prioritize the capacity as we have discussed and everything, we will say that we're tailoring assistance and we are unlocking full potentials to local actors like myself and my other colleagues. I think this is not just from Yemen or Sudan or any other place. It's general and it's global. And I think my presence here today is a testimony of GNC's commitment to capacity building And thank you so much. Over to you if you have any or other attendants, if they have any question about why this activity is very important. And I feel.
Thank you. Thank you very much, Dr. Hiba. I mean, capacity strengthening is very important. And we also appreciate even the wordings on the in the roadmap on the need to recognize the already existing capacity and complementing and not replacing the capacities of local and national actors. I'll hand it over to Dr. Nuha, who is the National Nutrition Programs Director for the Sudan Federal Ministry of Health. As we've all heard that the approach which nutrition cluster has taken is to ensure that we work together with the different respective government agencies. She has over 23 years of experience in primary healthcare and and primary mother and child healthcare, and she has also worked extensively with different agencies. So over to you, Dr. Nuha. Thank you.
Thank you very much, Dennis. Good morning, good afternoon, everybody. Hope you are all fine. For us to answer the same question, are you hearing me? Sorry.
Yes, we can hear you loud and clear.
Okay, thank you very much for that, Dennis. And thank you, Alex, for having me. As you said, I am Dr. Noha Salhin. I am representing the National Nutrition Program at the Federal Ministry of Health of Sudan. I'm very pleased to be part of this panel, and I will choose one activity, which is activity 35. For us in Sudan, this in line with the strategic objective of the NIC of the Global Nutrition Cluster. Number one, support the country's nutrition cluster and nutrition partners. And it is one of the main things I thought it is important for us in our country in the areas of accountability and monitoring. This activity is mainly a kind of a case study and lesson learned. We start negotiation about it this year after the conflict we are having in our country. We thought that, okay, how can we have a kind of assessment of what is the organizational capacity we are having in our country, and how can we strengthen it in the nutrition and emergency situation we are facing. So we started our communication, and for us, thank you very much for Alex and the localization team and the GNC for responding for our call for help by providing effective support to the local and national actors with delivering nutrition interventions in our country through this package of nutrition and emergency. So we ask for technical and organizational capacity strengthening support. And we started by selecting the organizations. I hope we will learn a lot while we are going through this process of learning and sharing experience with other countries. And at the beginning, we are looking for in-depth capacity assessment of the chosen national NGOs. And we are looking for a development of a capacity strengthening plan for each of these chosen NGOs, national NGOs. And we are also thinking about what are the key aspects of capacity strengthening in the planning and training, coaching for those NGOs. And we need to put it as a model for us in Sudan. How can we improve and strengthen the capacity of the organizations which are working in our country with this nutrition and emergency situation all of us in facing in most of our localities and states. we are speaking about almost half of the localities facing this problem. And when we start the implementation of our interventions, there were a lot of safety issues, and we couldn't find all the organizations working to resume the activities. It take a lot of time for us. That's why we are thinking about strengthening the capacity of our national NGOs. And we want to ensure that the systems are in place and we can manage and monitor the change. And we want to the support from the GNC to tell us about how can we document all the information we are having, and how can we make a kind of collaboration among all the national and international NGOs. This is what we think about the activity 35, and how can we make a benefit of this. And it is in-depth localization of an ongoing conflict which is going on in Sudan now. Thank you very much, and over to you, Dennis.
Thank you very much, Dr. Nuha. Great to also again note the capacity strengthening aspects that also the Sudan Federal Ministry of Health is also working to strengthen the capacity of the national actors. And I know in localization, we talk about facilitating capacity exchange. So that's a good, it's also a good practice that we see here in Sudan. I'll invite Dina. Dina, who is also the Senior Nutrition Advisor, Bureau of Humanitarian Assistance, USAID. And just to mention that she has worked for over 20 years in designing, managing, and implementing international nutrition programming and policies in over 7 countries. So happy to invite you, Dina, for you to share also your reflection, and also to mention how you see localization has been progressing over the different years, and also in the different countries that you have been programming. Many thanks.
Fantastic. Thank you so much, Dennis, for that lovely introduction. And I just wanted to thank you again for inviting me to the exciting launch of the roadmap. I'd also like to just take a moment to thank and congratulate Dennis, Martha, Alexa, and everybody that has worked on it so passionately and tirelessly on this really well-developed comprehensive roadmap. I've read many roadmaps in my day, and I actually found this to be quite interesting, clear, and quite extensive. So well done to you all. Well, I think all 42 of these activities are quite essential to shifting the power and building locally driven responses. And as Dr. Rasha mentioned in her opening remarks, moving towards that goal of using local organizations whenever possible and internationally when needed, I think all of those activities really drive towards that goal. And each of the activities that my colleagues on the panel have shared, I think, are incredibly pivotal, and having the GNC take concerted action and us moving towards this overall goal. One of the activities that when I read through that I feel it's quite crucial in enacting and seeing out this theory of change that Alexa mentioned earlier is activity 12, which is to establish a localization help desk position under the GNC aimed at direct support, developing partnerships, and supporting on resource mobilizations for LNAs, as well as adapting the GNC process to better serve the LNAs. So this is under that capacity strengthening. And why I think this is so pivotal is that the role, which is actually currently served by Alexa, but hopefully soon will be served by a local national actor, is, in my opinion, vital in rolling out all of the different activities that my colleagues have mentioned, but that are also within this roadmap. This person will be instrumental in actioning the various activities, identifying and communicating opportunities, facilitating partnerships, building capacity exchanges for LNAs, and honestly, just guiding the whole rollout of the roadmap. And I think that's going to be an incredibly important position. And so that's why I think it's one of the key activities. One of the other reasons why I think it is quite important to highlight was it really does highlight the support that USAID through BHA provides to the Global Nutrition Cluster, which is really around ensuring that these help desks are well staffed, well supported, and are able to focus on providing the technical support that is really needed to on-the-ground actors. But also, it really highlights and aligns well with our own USAID's soon-to-be released locally led humanitarian assistance policy, which is aimed at putting local actors kind of in the lead and strengthening local systems, which is, again, encapsulates everything that we talked about. The USAID policy really focuses on 5 main goals to realize this vision. And I think it's all of these goals that I'm about to mention are really well captured in this list of 42 activities that the GNC kind of highlighted as their roadmap to walk the walk, which is increasing the amount and accessibility of funding for local humanitarian organizations, which is what was highlighted previously in one of the activities that my colleagues mentioned. Strengthening USAID's ability to build humanitarian partnerships, and I think having the GNC help with that mentoring activity that Dr. Hiba mentioned, and all of these other different activities to kind of build that capacity, I think is really important. The third goal to realize USAID's vision is increasing capacity strengthening and mutual learning in humanitarian partnerships. Again, all key aspects of what the GNC is trying to roll out. The fourth one is to advocate for local humanitarian leadership, which I think is what we're trying to do and build up that at the more ground level. And the last one is really to leverage humanitarian diplomacy and policy leadership. And I think encouraging and building the capacity of those on the ground to actually take part in some of this policy leadership, I think is going to be incredibly important. So I'm so grateful to be here today to be able to talk through not just what I think the GNC will be able to do, but I think kind of what by USAID supporting the GNC, also what USAID can kind of help facilitate as well. So I think while all 42 activities are really important, I just wanted to really highlight on that one person that will be there to help guide us through this whole roadmap. So I just wanted to make sure that that was well highlighted. Thank you. Over.
Many thanks, Dina, for that, especially on the localization help desk. We've seen also in other clusters how that has actually supported to accelerate localization within their respective aspects. Colleagues, we are still awaiting the question and answers. If you have any question, any reflection, this is the time. Please, you can write it in the Q&A section. At this juncture, I would also like to invite my co-moderator, who will be leading us through the Q&A session. If you can proceed to the next slide, please. Just before I introduce my co-moderator, I'd like us to take a poll. So our tech team, please run the poll. So there are only 2 questions. We want to see, is localization talked about in your context? So the answer is no, rarely, sometimes, frequently. I can see responses have started streaming in. Okay, we'll proceed to the next question. Because of time, the next question. Is localization talked about in your context? That was the first question. Please, let's proceed to the next question. Is localization actioned in your context? So the first question was, is localization being talked about in your context? And the next question is localization being actioned in your context? Okay, so maybe for the tech team, if we can look at how many responses we had in the first question. Is localization being talked about in your context? So we had, is localization action in your context? Rarely scored the highest at 37%, sometimes scored the second highest at 32%. Then we had 21% frequently, which is also a good aspect. And then no, it was at 11%. Let's proceed to the other question on, is localization being talked about in your context? Alexa, your hand is up.
Oh, hi, Dennis. I just wanted to come in because I did jot down from question 2, the percentages. For question 2 about is localization talked about, no one said that it was not talked about. So everyone said it was talked about in their context. Rarely was just 17%, sometimes was 33%, and 50% said it was frequently talked about. Back over to you.
Great. So we can see a bit of some disparity between talked about and actioned. We see talked about is, scored frequently 50%. But when you look at is localization being actioned, frequently has only scored 22%. 22%. So good for us to actually walk the talk on localization. I'll introduce my my co-moderator, Martha Nakakande. Just proceed to the next slide, please. And just to mention that Martha Nakakande is the GNC CMAM advisor hosted by the International Medical Corps. She has experience working in various contexts in nutrition programs and supporting LNAs. She also co-chairs the anti-racism and localization workstream and the GNC localization task force member. And she's very passionate about forwarding the cause and efforts by local and national actors. Allow me to invite Martha to lead us in this Q&A session. Over to you, Martha.
Thank you, Dennis, and thank you to all the panelists and the speakers. It's quite an intriguing and interesting conversation. And I do hope by the end of the sessions today, we will not just only think about talking about localization, but really actioning it. And the roadmap is one way in which partners can actually support in actioning localization. We definitely need to put more efforts into going beyond words. We do not have a lot of questions. I will ask members to share any questions they have in the Q&A. The first question goes to Dr. Heber, and someone is asking you to tell us a little bit more about the specific support you received from the GNC and how this has strengthened your organization's ability to provide nutrition services. Over to you, Dr. Heber.
Hello back. I'm really glad to answer this question, and thank you for whomever put this question here. In 2021, BFD evaluated that we were only implementing projects by sector. So if we are responding to nutrition, we only gather or raise a proposal and think about activities in just sector, one sector at a time. So health was responding differently in different areas, and health activities, they were not coming together with other nutrition or wash and such. So what we did is that we approached the GNC asking their support in how can we develop a nutrition-sensitive, internal nutrition-sensitive strategy. At that time, they have listened to us. They have done a need assessment. They also have provided a small budget for an expert. At that time, I think it's N4D, Nutrition for Development. These external experts have worked with us closely to develop a nutrition-sensitive multi-sectoral strategy for BFD. This has helped us greatly when we approached donors and when we constructed proposals, not to think about them from one sector's perspective. We thought about them from a collective sectors and a response to an area of a collective activities gathered from WASH, nutrition, health, education, and etc. At that time as well, we wanted to develop more, not just responding to emergency. We also wanted to think about more about how can we respond before an event happened. So we wanted to think more about how can we change the social concept. So we also worked with Sona, I think she is here, about developing an species strategy for BFD. This is not just developing a strategy, also it's extended to a training. And at that time, we faced a lot of trouble for, translation. I was taking a part of a lot of translation myself with Sona, who helped us very great and built the capacity of not just the main team in Sana'a, but also in other. And then we approached donors to implement specific activities. We had fund from WFP, we had fund from DKH through the GFFO, and also we're now working with another activities and different donors to respond to a way to raise the people's awareness about the community behaviors and how can we change them towards better responses instead of just meeting the needs and without even exploring what is the problem. Later on, we also worked with Sona to develop a cash strategy. How can we provide people who would respond to the change of a behavior, but also conditioned to cash. And she helped us greatly in developing an internal policy or SLB with various different messages. I myself as well have received a mentorship program that was tailored to something that I really wanted to learn more about, which was an emergency response plan. And how can we do more risk analysis towards understanding the community? How can we do more about development, emergency response in various contexts? And I could say that, and I would take the opportunity to say thank you to Cecile. I don't think she's with us here, but she's working with the GNC. So I had various collaboration with the GNCs, and they didn't just build my capacity as Hiba, also they built our contextual organizational capacity and response into Yemen. And this is just not a document that we had in our shelf. It's something that we used to respond effectively and more swiftly. And we approach also donors to get more funds to implement these activities. So I think by that I answered all the questions, but if you still have more questions, whoever asked this, I'm happy to answer. Over to you, Martha.
Thank you, Dr. Hiba. And there is an additional comment from Jakan saying that although really localization is the great way to go, we also need to be cognizant of the strength and weaknesses that exist as well, including acceptability in the community as an issue and also respect by government departments. And suggest that one of the things we need to do is to make sure you're doing a phased approach to support their capacity building and ensuring that they get the traction and support from government departments. He suggests the need for a more blended approach, not just following buzzwords. And thank you for that. I agree. Instead of us really just saying things, we need to take some action. And one of the actions we're taking was that of developing this roadmap, which we'll hope will take us to a greater way of applying localization. And just to add on, in case anyone needs more support, more appreciation, more understanding of how in-depth we can go as the GNC to support you as an LNA or any other organization, you can engage us through the website by putting in a request. And as already mentioned, we do have a localization help desk, so someone can actually email our Alexa directly and be able to get the support they need. Alexa, I hope you can be able to share your email, in addition to where we can actually where we can actually make a request on the GNC website. Do we still have it? We only have 1 more minute for questions. I wonder if we do have any questions left within the group. If we do not, I will hand over back to Dennis. And thank you very much. Thanks, Hiba, for responding to that question.
Many thanks, Martha, for leading on that Q&A. We are still not locking out any comments or any reflections that might come from participants. So if you feel that you have a comment that you might also want to raise or a reflection, you can raise your hand and we'll give you a minute to share. At this juncture, colleagues, I would like to invite Alexa back. This is the moment that we've all been waiting for. So I'd like to invite Alexa for her to lead us through the launch of the GNC localization roadmap. Many thanks, colleagues.
Great. Thank you so much, Dennis, and everyone who's here and a part of this and making this such an exciting event. I'm very pleased to announce, actually, next slide, please. Yeah, very pleased to announce that the document is currently available on the GNC website. We're going to put the link in the chat. It was finalized very recently and just put online this morning. So this is hot off the presses, as we say. This document came together thanks to many hours of exploration, discussion, collaboration between many great minds, providing their insights and their suggestions. And we consider this to be, as it's already been said in many ways today, an important step. It signals a strategic shift and for the second term of the GNC strategy. And we hope it's also going to be a way for us to really walk the talk and not just have localization be a buzzword. So this is, although the document is now a finalized resource, it's going to be available for anyone who wants to have access to it. We're still going to be aiming to apply a sort of adaptive management strategy. So we want to be continually learning from our experiences and from learning from you and everyone in the Nutrition Collective, especially from local and national actors, as we progress in actualizing these activities and fostering a more enabling environment for localization. And we recognize that although this is a document for the GNC, it's ultimately for the collective, and we welcome your collaboration in realizing the activities. If there's something that stands out to you in the roadmap that you're interested in, please let us know. And we welcome any feedback on how we can continually do better, because that's what we're going to have to keep pushing for, is continuing to do better and shift power. So please don't hesitate to contact us anytime. You can either reach us through the GNC website. We have a request support button up in the right-hand corner, or you can feel free to reach out to us directly. I will put my email in the chat box. And just thanks again, everyone. Really appreciated. Back over to you, Dennis.
Many thanks, Alexa. So I've just shared also the link to the roadmap. You can click on it, you can download it, you can share it widely in your different constituents. And they say that for every beginning, we must also have an end. At this juncture, I'd like to invite once again Dr. Nuha to close for us, give us closing remark together with Dr. Mayada. Many thanks, colleagues. Thanks.
Thank you very much. It was very exciting launching for us, all of us today, and to speak about closing remarks. This is a little bit painful for all of us. I think this roadmap fulfill its objectives very, 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 very highly, putting into consideration the ongoing GNC efforts all over the world and the theory of change and balancing the power between the local, national, and international partners. This is really covered in the document, and also the way forward for all of us and how to complement the GNC strategies. Localization is one of the major issues we found it here today, and this document is very essential for all of us working in humanitarian response. And we have also seen how it covers many areas and having to be a kind of sustainable roadmap. Everyone in there, leave no one behind. Talking about even the disabilities, the youth, the women, which is most of the time forgotten. This roadmap take everyone with it on board. Tell us how to coordinate, how to communicate, and how to support each other to reach the children, the vulnerable people during humanitarian response. How can we elaborate all our efforts together, governments, local UN and NGOs, UN agencies, and everyone to deliver our service. So very, very, very happy to be part of this, and congratulations to the localization team for this great effort they did. And I think this roadmap is now ours for all of us working in humanitarian response, and it is a kind of it's not just a launch, it's a real road map we are going to follow, and I think together we can. That's all I can say for this. Thank you very much, and over to you, Mayada.
Thank you, Dr. Noha. Thank you, Dennis, for facilitating this great session. So we just wanted, in complementing the great words that Dr. Noha just said, we would like to thank the GNC for their leadership in walking the talk on localization. Today, more than ever, strengthening the engagement with local actors is important, and local actors have a great role to play in the implementation of nutrition activities, and thus increasing the efficiency of the cluster. I think also today the discussion points towards the great role and responsibility that clusters play at the country level to ensure coordination is in place to roll out this roadmap, ensuring the appropriate relationship with local actors as well as with the national authorities. As was said previously, locally driven and locally led humanitarian response ensures sustainable nutrition, ensures the sustainability of our activities. Collectively, we can improve service delivery to reach those vulnerable children and mothers that we all serve. My sincere thanks on behalf of all to Alexa and the GNC localization team. My sincere thanks to the panelists and the participants today for your great engagement. And I'll hand it over to you, Dennis. Thank you very much. Over.
As a moderator, I have nothing else to say after the closing remarks, wishing each one of us a productive day ahead, and looking forward to working collectively together in accelerating localization in the nutrition clusters. Many thanks. Thank you.
Thank you all.
Thank you, colleagues.
Thank you and bye.
Thank you. Bye-bye.
Thanks, everyone.